Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be talking about the differences between isotonic, hypotonic, and hypertonic IV solutions. So the first things we need to know is how are they classified as such? So they are categorized according to their osmolality in relation to the blood. So are they very close to being the same as the blood? Are they more or less than the blood? So that is how they're categorized. The other thing I wanted to point out is that they are all considered crystalloids. So what's a crystalloid? They contain small molecules that flow easily across a semi-permeable membrane from the blood into the cells and the tissues. So those are crystalloids. Later on in the video, we'll talk about something called colloids. So all three, isotonic, hypotonic, and hypertonic, are crystalloids. So let's start with the first one. Let's start with isotonic. So isotonic, their osmolality is the closest it could possibly be to our extracellular fluid, which is a good thing. So they don't cause our red blood cells to shrink or expand. And their job is actually to expand our extracellular fluid volume. So these are ideal in people who have fluid volume deficit. And the other thing I wanted to point out is the most commonly given ones. And why do you need to know this? Because these are medications, right? And you don't just give a medication without knowing what it is. That's not safe. So let's start with sodium chloride, 0.9% sodium chloride, aka normal saline. The most famous, most popular, most well-known one of all, right? So this is made of water, salt, and chloride. It is used to replace fluid deficits. And ways we can have fluid deficits could be vomiting, diarrhea, GI secretions, wound drainage, a bunch of different things can cause us to have these deficits. And then sodium chloride would be our medication of choice for that. One very special thing about this is it is the only medication we use when giving blood. So blood administration, red blood cells, we use sodium chloride along with that. It is also used in flushes, so if you have to flush your patient's IV. When is it not used? It's not great for patients who have heart failure, pulmonary edema, renal impairment, or sodium retention. And that kind of makes sense, right? It has a lot of salt in it. We're not going to give it to somebody who has a lot of salt in their body already, right? Also, its job is fluid deficits. These people are CHF, pulmonary edema, renal impairment people. They don't have fluid deficit, okay? They have fluid excess. So it would be contraindicated in these people. So that's sodium chloride. Now let's talk about LR, lactated ringers. Our LR is our lactated ringers solution, and this has a lot more stuff in it. So sodium chloride, potassium chloride, calcium chloride, sodium lactate, all within sterile water. This is great for patients who have burns, they have trauma, they have hypovolemia, hypotension, or we expect them to have a lot of blood loss. Very commonly used in the OR if your patient's having some sort of surgery, because there's always blood loss associated with surgery. And we use this on our patients in OB as well, because it's normal to have blood loss, when delivering. We want to be very cautious in using LR in our patients who have renal failure. And we don't want to let our patients who have liver failure have LR because they cannot metabolize the lactate that's in it. If your patient is very alkalytic, if they have a pH, if you do their ABGs, and they have a pH of greater than 7.5, you don't want to give this to them because their body will convert this into more bicarb, which is just going to make them even more alkalytic. So very careful when these patients, we need to caution them, and we shouldn't be using LR on those patients. The other isotonic IV fluid you might give is called D5W. So this one's kind of special because it's both isotonic and hypotonic. The D stands for dextrose, which is like sugar, like glucose, okay? So that glucose is very quickly metabolized, and then you just have the water left, which is just free water for the kidneys. So this is why it's both isotonic and hypotonic. It does contain a few calories from the dextrose, but this is not enough to sustain your patient. So if your patient can't eat, this is not going to be good enough for them. They're probably going to need a TPN or something like that. And then you do have to be cautious when your patients, maybe they have diabetes, because it can cause hyperglycemia. So these are just isotonic IV fluids. Now let's talk about hypotonic IV fluids. Now let's talk about hypotonic solutions. And why are they called that? Because they have the lower serum osmolality, and what they do is they take the fluid out of the blood and put it into the cells and the tissues. The most commonly known one, commonly used one you will see, is 0.45% sodium chloride, aka half normal saline. Okay, that's what it's called, half normal saline. This contains sodium chloride in sterile water. It's used for people who have hypernatremia, so too much salt, and then diabetic ketoacidosis. You have to be careful with this because rapid infusion could cause hemolysis of red blood cells. It may worsen hypovolemia and hypotension if your patient has those, so you got to make sure that you're not giving it if they have those, which you wouldn't anyway, because we know it's pulling all that stuff out of the blood. You want to monitor for signs and symptoms of fluid volume deficit. And then this is not given to patients who have increased intracranial pressure, burns, or liver disease. So you see how this is very different than an isotonic solution. They do very different things. Now let's talk about hypertonic solutions. So hypertonic solutions draw water out of the cells to increase that extracellular fluid volume. They are volume expanders, and they are typically used for patients who are higher acuity, and they are used for a shorter amount of time than the others. So some common ones include 3% or 5% sodium chloride. These are for patients who have critical levels of hyponatremia, so very dangerously low levels of sodium. We want to be very cautious. We want to give this very slowly. D5 half normal saline is used for patients who have hypovolemia and can be used as a maintenance IV. But in this, we want to make sure we're monitoring for fluid volume overload. D5 normal saline is helpful because it provides calories, water, and electrolytes to our patients. We'll start here. D5LR, very similar to D5 normal saline in the fact that it provides calories, water, and electrolytes, but because of the LR, contains the sodium lactate, right? So it contains sodium lactate, which is helpful if your patient has metabolic acidosis. So that's why you might want to choose the D5LR over the D5 normal saline. D10W, so 10% dextrose in water, that's what that means, provides free water and calories, but it doesn't provide any electrolytes to our patients. Very typically used with central lines instead of peripheral lines. And for these patients, we want to make sure we're monitoring for hypokalemia. And then for all 4 of these, 5 of these I just discussed, we want to avoid the use of these in our patients who have CHF, so congestive heart failure, and renal failure when they're dehydrated. And definitely we don't want to give these to our patients who have diabetic ketoacidosis. So all of these, isotonic, hypertonic, hypotonic, all 3 of these are considered crystalloids. Now I just wanted to take a minute to talk about what a colloid is. Now let's talk about colloids. If you remember from the beginning of the video, crystalloids are those small molecules and they pass through the membrane. Colloids are large and they don't. So they are large molecules that do not pass through the semi-permeable membranes and remain in the blood vessels. What they do is draw fluid from the interstitial space into the vessels. And because they are bigger, we need to use big needles, so an 18 gauge or larger when administering these. And we also want to monitor the patient's coagulation indexes. The colloid that we give is albumin, either 5% or 25%. This is used for protein replacement and hemodynamic stability for patients who are in shock. we have to do some special nursing considerations with these. So ACE inhibitors. If your patient is on an ACE inhibitor and you know that you will be administering albumin, ideally you would be able to hold that medication for at least 24 hours prior to administering the albumin. And this is contraindicated in patients who have severe anemia and congestive heart failure. So that was my video on the different types of IV solutions, isotonic, hypotonic, hypertonic, and a little bit about crystalloids versus colloids. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.